Welcome back to Doctors Reacts, the podcast where we translate medical jargon into plain English so you can take charge of your health. We have Dr. Vani and Dr. Kev to unpacking Malaysia's 10 new TB clusters. Learn why this silent squatter is different from COVID-19, the reality of the Johor outbreak, and why the 2-week cough rule matters.
Welcome to today's custom-tailored deep dive. We're really thrilled to have you with us for this one.
Yeah, thanks for joining us. This is a big topic.
It is, because today we need to talk about a recent headline that, frankly, has a lot of people feeling, a bit anxious right now.
Right, the sudden emergence of multiple tuberculosis clusters.
Exactly, TB clusters popping up right here in Malaysia. And to get a really clear, comprehensive picture for you, we've pulled together a fantastic stack of sources today.
We're looking at on-the-ground reporting from CNA, TRP, and the Star.
Yeah, and to make sure we've got the science right, we are pairing all that news data with a really informative medical broadcast transcript.
Which is essential because relying just on the headlines can distort the reality of the risk.
Totally. So our mission for you today is to basically cut right through that anxiety. We want to separate the facts from the panic and understand exactly how TB operates.
And it behaves very differently from the pandemics we're used to.
Oh, massively. And most importantly, we want to extract the crucial insights you need to protect your family. Okay, let's unpack this.
Because the numbers coming out of the Ministry of Health are definitely demanding our attention.
They really are.
Right.
I mean, let's look at the sheer scale of the CNA data. The Health Ministry confirmed Malaysia detected 10 new active TB clusters early this year.
Just early this year.
Right. And if you narrow that down to just between January 1st and February 7th, there were over 2,500 cases reported.
Wow.
Nationwide. And to put that raw number into perspective for you, that is an almost 10% jump from the exact same period last year.
Yeah, and a 10% year-over-year increase is a massive red flag.
It really is.
To really grasp how this moves, we should look at the specific case study our sources highlighted, the major cluster in Johor.
Right. The index case there was a 72-year-old religious teacher in Kota Tinggi.
And her profession is the critical variable there.
Because she's in close, prolonged contact with students. The reporting from the Star detailed this immense logistical effort that followed her diagnosis. They had to track down and screen between 800 and 900 close contacts.
Which is staggering, just the administrative disruption of pulling nearly 1,000 people out of their lives for screening.
And it yielded results.
Right.
Out of all those contacts, they found over 30 positive cases linked to that single cluster.
Yes. And the demographic breakdown is the alarming part. Most of those positive cases were children.
Which is it's incredibly sobering to read.
It is.
But while Johor had the highest concentration in one cluster, TRP's reporting makes it clear this is broader.
Yeah, Selangor actually has the most individual clusters right now. They're tracking 4 active clusters.
Which makes sense with the urban density there.
Right, and active clusters are popping up in Sabah, Pahang, Kedah, Kelantan, and Perlis. It's a nationwide issue.
What's fascinating here is...
Sorry, go ahead.
No, I was just thinking about the psychological impact. When you hear cluster or outbreak or contact tracing, hundreds of people...
It instantly triggers our 2020 COVID-19 lockdown PTSD.
Yes, exactly. Our brains immediately associate those words with rapid, unstoppable airborne spread, sudden fevers, total isolation.
Which is completely understandable.
It makes total sense if you're feeling that knot in your stomach right now. But here is the core thesis of our deep dive today.
TB is fundamentally different from COVID-19.
They do not attack the human body the same way, and they don't spread the same way.
And understanding that difference is exactly how you move out of panic and into actual preparedness.
Okay, so while I was reading through the medical broadcast transcript for today, I found this brilliant analogy. I want to use it to help visualize this for you. I want you to think of your lungs as a house.
A house with a built-in security system, which is your immune response.
Right. Now, COVID-19 is a smash-and-grab burglar. It kicks down the front door, the alarm bells ring instantly.
It's not subtle at all.
Not at all. Within days of that virus getting into your house, you know it. High fever, violent cough, you lose your sense of taste.
It's fast, it's loud.
And because you know exactly when you've been hit, you know to isolate immediately to protect your family.
The timeline is measured in mere days.
Here's where it gets really interesting, because TB is not a smash-and-grab burglar.
Far from it. TB is a silent squatter.
A silent squatter.
Right. It's caused by a bacteria, not a virus, and it's incredibly slow-moving. It doesn't kick down the door. It sneaks in through an open window and hides out in the basement.
Just totally undetected.
Completely. And this brings us to the crucial difference between latent TB and active TB. When that squatter first enters your lungs, your immune system basically builds a wall around it to trap it.
So it literally seals off the basement.
Yes, this is latent TB. The squatter is inside you, but it's asleep.
So you have zero symptoms.
Zero. You aren't sick, and this is the most important part for public health. You cannot infect anyone else. It can sleep down there for weeks, months, or years.
You could have this bacteria in your system right now and have no idea.
Many people do, but the danger is the second phase, active TB. If your immune system gets distracted, say you get really stressed, you develop diabetes, or you just get older.
That wall breaks down.
Exactly. The squatter wakes up and slowly starts causing damage.
If we connect this to the bigger picture, that long, quiet incubation period really explains why we are seeing these clusters in very specific places.
Like enclosed spaces, schools, tightly packed offices, close-knit communities.
Because with COVID, if someone is sick in a classroom, they show symptoms in 3 days and they stay home.
The chain of transmission gets broken quickly.
Right. But with TB, a person might have the active bacteria slowly growing in their lungs for weeks before they feel sick enough to go to a doctor.
They might just think, oh, it's just a stubborn cough, it's allergies.
But day after day, in that enclosed, air-conditioned classroom, they're breathing out tiny droplets of bacteria.
And that's the reality of how it spreads. You won't catch TB from casually walking past someone in a supermarket.
Well, I guess it's too slow-moving for that, right?
Exactly. It requires prolonged, close-range exposure in enclosed, poorly ventilated spaces.
Like sitting next to an infected person for 8 hours a day.
Day after day. That's how the squatter moves from one house to another.
Which brings us to the Ministry of Health's 2-week rule. They're pushing this so hard right now.
It's the best defense we have.
If your internal alarm rings for a week, a cough, a runny nose, it might just be a standard cold. Your smash-and-grab burglar.
Your body usually clears that out.
But if you have a cough that lingers for more than 2 weeks, that is your body telling you the squatter is awake.
Especially if that lingering cough comes with night sweats, loss of appetite, or unexplained weight loss.
So what does this all mean? What should you actually do if you hit that 2-week mark?
Well, first, don't panic. TB is 100% curable with the right antibiotics.
That's a huge relief compared to viral infections.
It is, but it requires serious commitment. It's usually a 6 to 9 month minimum course of medication.
Taking heavy antibiotics every day for 9 months is a lot.
It is. The medical protocol is rigorous. They check symptoms, do clinical lung exams, chest x-rays, and sputum tests to confirm the bacteria.
And the sources mentioned DOT, right? Directly observed therapy.
Yes, DOT is crucial. Healthcare workers literally monitor patients to ensure they finish their meds.
Why is that so strictly enforced?
Because if a patient feels better after 2 months and stops taking the pills, the strongest bacteria survive.
And then they multiply.
Exactly. That leads to ongoing transmission and the creation of drug-resistant TB, which is incredibly difficult and expensive to treat.
Now, diving into the reporting, there's a statistic that might seem contradictory. Malaysia has a national immunization program that achieved nearly 99% herd immunity among kids.
Using the BCG vaccine.
Right. So if we have 99% vaccination in kids, how are we seeing clusters where the majority of cases are children?
It's a very common misconception about the vaccine. The BCG vaccine is exceptional at preventing the most severe, fatal forms of TB in infants, things like TB meningitis.
So it saves lives.
It undeniably saves thousands of lives. However, it doesn't completely prevent the initial latent infection from entering the lungs.
It stops it from killing the child, but the squatter still gets in the basement.
Precisely. The latent bacteria is still there in the community, waiting for a drop in immunity to flare up. That's why we haven't eradicated it yet.
That makes total sense. So for everyday protection, what do the epidemiologists recommend? We're all back in offices and schools now.
It's all about environmental controls. Because TB thrives in recycled air, the #1 piece of advice is to improve ventilation.
Just keep doors and windows open.
Keep them open whenever possible, dilute the air in those enclosed spaces.
And what about public transport? You can't open a window on a train.
For tightly packed transit, especially during high travel seasons, consider wearing a mask. It adds a physical barrier against those droplets.
It's a simple way to add an extra layer of security to your house. So to synthesize all this for you today, remember the 2-week rule. If you or your family has a cough for more than 2 weeks, don't ignore it. Get checked. Finding it early doesn't just save your lungs, it stops the squatter from moving into your family's house and protects your community.
This raises an important question,
Yeah.
one that wasn't fully discussed in the medical sources, but it's worth pondering. We now know that TB thrives on prolonged exposure in enclosed spaces. What if our modern shift toward tightly sealed, heavily air-conditioned offices and classrooms isn't just about energy efficiency?
You mean it might be making things worse?
It might be inadvertently creating the perfect architectural incubators for this ancient, silent squatter to thrive in the 21st century. How much might we need to rethink the very design of our modern, everyday environments to truly evict it?
That is a fascinating thought to leave you with today, especially next time you're sitting in a windowless office. Thank you so much for joining us on this deep dive. We hope you feel empowered to protect your family with the facts. Stay safe, remember the 2-week rule, and we'll see you next time.
Thanks for tuning in to Dr. Reacts. Stay healthy, stay informed, and we'll catch you on the next episode.